Sometimes people face diarrhea along with blood. So, what could be the reason behind it? Is it caused by the Shigella or the other cause? So, dysentery, also known as bloody diarrhea, is caused by the Shigella, but it could be caused by the other factors. But we will focus on the Shigella, which is one of the most important reasons behind the dysentery, or you can say bloody diarrhea. So, first of all, we will see the properties of the Shigella. Shigella is a gram-negative bacteria. Whenever you listen the word gram-negative, you see the difference in the structures in the cell wall of the bacteria, and in the microscopy after the gram staining, gram negative bacteria will look pink while the gram positive bacteria will look purple in color. So it's a gram negative, it will look pink in color. It's a non-motile. There is no flagella present in the Shigella, which is the most important features that distinguish it from the Salmonella. Another non-spore forming, it doesn't form any spore, and it is facultative anaerobes. It can grow on the aerobic and anaerobic conditions. So these are the general features of the Shigella. And if we look at the classification, so we have categorized the Shigella into four groups: A, B, C, and the D. So in the A group, you will see the species Shigella dysentery. So it is epidemic, it causes the epidemic dysentery, and it is the most severe form of the Shigella. B group Shigella flexneri, and it is common in the developing countries. Third is the C Shigella boydii, and it is less common. And D group, you will see Shigella sonnei, and it is common in the developed countries. So we have categorized Shigella into four groups. Next, we will see pathogenesis, how Shigella causes the bloody diarrhea, or you can say dysentery. So first of all, we have to know where this bacteria enter in our body, from through which route. So it is entered through the oral route. Oral route. How? So you have to remember 4F. It can transmit through the fingers that are contaminated with the uh, food and the water, which is further contaminated with the stool. Flies, food, contaminated food, and the feces. So these are the important transmission through which the Shigella enters in our body. It will enter into the mouth, and after that it will enter into the stomach. So it can prevent itself from the stomach acid, and after that it will enter in our small intestine. So now it targets our small intestine and the largest intestine. So it causes the enterocolitis. What does it mean? Entero mean small intestine, and colitis mean large intestine inflammation. So mostly it causes the inflammation in the large part of the small intestine and in the large intestine, which is also known as colon. So it affects the innermost layer, enterocytes, and which is which line our small intestine and the large intestine. It attacks on these cells and multiply in these enterocytes and causes death of these enterocytes. And ultimately, you will see the formations of the ulcer at that side, and at that side you will see the bleeding. And ultimately, whenever the patient passes the stool, you will also see the blood in the stool due to the ulcer formation in the uh, colon, or you can say large intestine, due to the attack of this bacteria. This bacteria, Shigella, also produce the Shiga toxin. Shiga Toxin. We can also say enterotoxin because it is present in our gut or small intestine. So Shiga toxin also attack on the enterocytes, and it affects or inhibit the protein synthesis in our enterocytes. So this is how this bacteria enter in our small intestine and causes the bloody diarrhea, or you can say dysentery. So when the patient pass the stool, this stool having uh, Shiga toxin and this stool having Shigella in it. So whenever this stool contaminated food again enter into the other persons, so it causes the dysentery in the other persons. So you have to be careful about hygiene. So it transmits through the orophycal route, so it circulates from one person to another. So that is the important thing which you have to remember. Shigella causes the enterocolitis. We can also say shigellosis or bacillary dysentery. What will be the symptoms of these dysentery? You will see the sudden fevers and the chills. You can also see the abdominal pain and the cramps. So patient present with these symptoms. Tenesmus, you will see the straining during defecation, and you can also see the watery. At the start, you can see the watery diarrhea, but after that, you can see the bloody diarrhea in that case. Dehydration, and in the most severe cases, due to the productions of the Shiga toxin, you can also see the hemolytic uremic syndrome, in which you will see the three most important features: hemolytic anemia, thrombocytopenia, reduce in the platelets count in the CBC report, and the acute renal failure. So these are the different symptoms in the HUS, and it is uh, seen in most severe cases. Lab diagnosis: in the stool microscopy, we will take the specimen of the stool and we can check RBCs, pus, and the mucus. So after that, you can also go towards the culture. In the culture, we have three media on which we can grow the Shigella meconchi, that is good for the gram negative bacteria, and Shigella is a gram negative bacteria, and the Shigella form the colorless colonies or the pale colonies on the meconchi agar, and XLD agar, it forms the red colonies without black productions, because Shigella does not produce any hydrogen sulfide, and it can also grow on the SS agar, Salmonella, Shigella agar. So these are the three most important media you have to remember. And in the biochemical test, it's catalase positive, and it is glucose fermentation test is also positive, and the triple sugar iron test, in the it has two forms. At the top you will see the slant, and at the bottom you will see the butt. At the slant, it is alkaline and it produces the red color, and at the butt it is acidic in nature and it produces the yellow color. So an important thing, there is no gas production in the test tube, and there is no blackish color produced by the hydrogen sulfides, because this bacteria doesn't produce any the hydrogen sulfide gas. Molecular test, you can go toward the PCR, polymerase chain reactions, and serology slide agglutination test. You will see the agglutination formations and the serology test. In the treatment, antibiotics, mostly we will not take the antibodies, but in severe cases we can go towards the antibiotics after the sensitivity. So it's a good practice after the sensitivity testing. So ciprofloxacin, azithromycin, and the ceftriaxone, but that will be decided according to the conditions of the patient and after the test or antibiotic sensitivity testing. Hydration therapy, ORS, oral rehydration solutions, and the IV line. So these are the different methods we can cover the hydration therapy. Next, we will see the scenario. A 7-year-old boy, it's a young one, and is brought to the clinic with fever. Patient is presenting with fever, abdominal cramps, frequent small stool, small volume stool. and mixed with blood and the mucus for past 2 days. The patient is presenting with these symptoms. His mother reports that he had eaten food from a street vendor before symptoms began. So it means most probably this child has eaten contaminated food. And in the microscopy, stool microscopy, we have seen red blood cells and the pus, and in the culture, we have seen the uh, non-lactose fermenting colonies (NLF) on the McConkey agar, and mortality test is negative because Shigella does not move. It go towards the dysentery caused by the Shigella. So this is all about the Shigella. If you still have any question, you may ask in the comment section. Thank you so much.